Good afternoon, everybody. Today is December 10th, 2021. My name's Scott McGann with the Falmouth Health Department. Doing your weekly COVID-19 update. Our email is health@falmouthma.gov. Our phone number is 508-495-7485, and our website is falmouthma.gov. So I'll post this presentation will be posted on it as well as through FCTV. So we did not have a good week, and nor did anyone else. We're at 2,343 cases, 82 over the week with 31 probables. That's a high count. Our positivity is 28.4, which is up from 22.1. Our positivity stayed pretty much the same from 4.5 up to 4.8. So looking at the chart, you can see in the far right, you've got 1, 2, 3, 4, 5 straight weeks of a sharp increase. Very similar to if you look over midway through on the November 2020, December 20 of 2020 in that area. You can see sort of a similar increase. So right after Thanksgiving, boom, the cases come up. You know, it's getting dark early. We all got together. That's just what happened last year. And it's a similar pattern this year, though 2020 is not the same as 2021 because we are vaccinated for the most part, and the disease is going to be much milder in those that have been vaccinated, which I'll have a slide on later. But definitely an increase in cases that we've seen similar to last year. The flatter and more densely packed these circles are, the better we're doing. You can start seeing them separate and increase right here in the far right, similar to what you would have seen, again, that November, December into January January 21 being our worst month. So that's where we are with cases in Falmouth. The county-wide, the cases are similar. You can see the far right is the more recent data counts. These are three-day case counts. So we had a huge, and then we're down into 3. So they had their second largest all-time spike or 3-day case count was, looks like roughly around last week. Earlier in the week to last week. Similar to us, we saw, we are part of that case count, so, we see that. So as far as hospitalizations go, you can see down at the bottom, we were zeros early November, worked our way to 5 and 1, 11 and 0, 8 and 1. So we're not seeing necessarily the ICU visits. That's still on a manageable basis here, but you are seeing an increase in beds, and that's mainly among the unvaxxed. Coming over to the state counts, you're seeing about 5,000 cases per day. That is way up from the 1,500 we might have been seeing 2 months ago. You're seeing an increase, obviously, hospitalizations. Our positivities hit 5% for the state for this time frame. This is between, this is a 7-day average for the last 7 days. Data releases of the 8th. You can see all the trends are on the way up. Deaths are not. Vaccine helps, definitely helps, and that doesn't necessarily, the purple, show an increase. Our positivity creeped up. Our cases definitely show a big spike coming up in here, and hospitalizations, again, a lot of your cases are unvaxxed, so what ends up happening is hospitalizations will definitely tag along with cases. As far as we're doing with our peers, with our incident rate being 28.4, that is a daily case count if we had a population of 100,000. So this chart takes all the populations, the varying populations, out of the mix by setting all the populations to 100,000. So 28.4 is roughly 9 cases per day for Falmouth because we're 1/3 of 100,000 roughly in our population. So that's about 9 cases per day. And you can see our peers we're definitely in the lower half of the grouping. You can see that the entire state was 47.7 per 100,000. So we're doing better, quite a bit better than the state average right now. And with some towns on the Cape higher, or some right around the same. So that's where we are with that. As far as positivity, it's very similar. State's 4.46. We're slightly higher than the state average on positivity. But better than our peers. We got some towns like Harwich is over 10%. That's very high. Dennis is very high. Bourne's high. Yarmouth's high. Sandwich is high. So among our peers, we're actually, we're doing better than our neighbors in the county. Still not good numbers any which way you try to shake it. The good news is that this chart comes from the state every week. Okay, this says out of all the vaccinated people, 1.8% breakthrough. 88,968 cases. So when you see the case counts jumping, you don't necessarily see this number jumping quite the same as fast. So again, vaccinations work. If you take the hospitalizations among cases, it's 3.05% of the breakthrough cases that result in hospitalization. And as I put this up, I think I've been putting this up a couple months now. The number was more closer to 4%. So there definitely has not been an increase as time progresses and there's less vaccine efficacy as vaccine ages, the further away that you've had it. Definitely not showing in the data it's actually lower. So hospitalizations, that number is actually lower. It's in like 3.05 out of these two numbers, as opposed to being, I think it was 3.7, 3.8 at one point. The deaths among cases have been holding right around that 0.6, 0.7, so less than 1% deaths among breakthrough cases. So 647 deaths over a vaccination of 4.9 million, almost 5 million, is actually a pretty low number. I mean, obviously, if it's someone so the 647, you may not feel that way, but that is a very low number because you got to remember that a certain percentage of the population is either very elderly or immune compromised, comorbidities, things of that nature. That sort of that number is, so the number of the hospitalizations and deaths among vaccinated people are, by and large, very low. Our vaccination rates, there's actually a drop. I had to do a double take from the numbers from last week, and I think it's because I've been asking the state on a call, the department's asked the state a couple of times, where do the booster, I like to see a third column in the state's data for booster doses. I think some of the reporting entities, it could have been a pharmacy or something, were reporting them as first doses, or they were being counted as first doses. So you see a drop in the total number of first doses. I think just because we overcounted, some boosters were counted as first doses. I don't have any control, the health department, we don't have any control over this. This just comes from the state's dashboard every Thursday afternoon, and I noticed that the number was low, and I think they just adjusted out some of that, and I think they're working on giving me a booster, giving the towns a booster. I like to see that in the dashboard, total number of booster shots given. And I think some of these numbers, we were seeing like 400 doses last week, first doses. That seemed awfully high. Some of them were definitely, and I put that in the notes last time, I think, for booster doses. So that's why that number is slightly lower. Still, again, robust vaccination rates. We see where we're doing our focus on vaccinating using the VNA in Barnstable County is in the newly allowed or newly authorized 5 to 11-year-olds. It's been a few weeks now, and 1/3 of that population has been at least had their first dose. We've had a 10% increase to 18% in second doses. There's obviously going to be a delay because a lot of the children, either they got it through the schools or through their pediatrician, obviously have to wait the 21 days. But that's where you see a lot of the efforts in our clinics doing the school-based ones. Okay, so again, strong vaccination. We're at 80.5% of all eligible residents, even with the newly approved 5 to 11-year-olds. Obviously dropped that number a few weeks back, but we're over 80% of all eligible residents are fully vaccinated, even with that 5 to 11 still working on that group. So good job on that. Vaccine availability, again, vaxfinder.mass.gov, Convenient MD, the pharmacies, there's 6 pharmacies in town that can do it. So it's Walmart, Shaw's, Stop and Shop, 2 CVS's, and a Walgreens. So there's plenty of opportunities. Barnstable County Health Office is still doing their clinic. I think they're at Thursdays now. They may be switching that to Wednesdays. Community Health Center can still do them. So we have clinics. The homebound can definitely call the health department. We can schedule that. Some people have called the senior center. That's what we did early in the spring because of the help that we needed for answering calls. I think right now you can just call the health department. We'll refer you to the VNA, and the VNA will make that appointment. Recently, you've noticed if you've tried to get a booster that you've had to have a wait. And it might seem a little frustrating. I think part of it is because when you open up the category from 60-year-olds down to 18-year-olds, that was done a few weeks ago, plus Omicron and the holidays. I think there's been a big push for the boosters, which is great, but that push puts a strain on the amount of available shots, so it does tend to cause a bit of a delay that needs to be caught up, and I think they'll catch up pretty quick. The health department's working on doing a clinic probably at the Gus Canty. I got to get it scheduled with the VNA and finalize a date, because the VNA is busy out doing all their towns, not just Falmouth, doing clinics in the schools. Barnstable County is also doing the same in the schools. We use both. And so that does keep staff down to, being able to do larger clinics. So I'll probably have something of a smaller size, reasonable size. I would like to be able to do multiple. And also, when I see the pharmacies catch up, then not need to do them. I will post them on our website once they get finalized. It's just that the VNA, their nurses are out doing vaccine clinics, and so is the county at the schools. It does make more sense to get unvaccinated their vaccines before we focus on boosters. And also, the schools, it's a great place for the kids to be able to do it at that age, and so that's where our focus has been. But again, if you're following the different, I've heard different things from different people. I've heard 2 or 3 week delays. I've heard 3 or 4 week delays to their appointment. I've also had people tell me that they were able to get it within 2 or 3 days. Some you'll have to kind of learn the system for whether it's Walmart or CVS. Some of them will post early in the morning. Some may have better luck if you call. I'm not quite sure. I don't have those tricks available to me. I don't know exactly, but some people I've been heard both ways. And again, we'll have a clinic, maybe multiple clinics, based on how much availability I can get from the VNA. As far as testing, not much has changed. You got the fairgrounds, community health center, you got the hospital still doing it, CVS, Convenient MD, and we're definitely still doing the school-based test and stay to keep the kids in school that may have been exposed by a case in the school. So the testing is still, we're robust on our testing. I think that's part of the reason why our positivity isn't as high. We do a lot of testing in Falmouth, so that's great. Booster doses, COVID, you can either, again, vaxfinder.mass.gov. You can also call 211, so if you can't do the phone, you can work on it if you can't do online, you can try the 211 number. Just expanded that age down to 16, so there's 2 more age groups, 16s and 17s, that'll be able to get their boosters. Again, that'll increase demand, not as much as going from 18 to 60. You can mix vaccines, so nothing's changed with that. So it's after 6 months, you can get Moderna, Pfizer, J&J. If you originally got that's if you originally got Pfizer or Moderna. If you've got J&J, you can go 2 months, and you can get a booster of any one of the 3. So not much has changed with that. There's still those Paxlovid. I think they're about to submit. Pfizer's ready to submit in the next day or two, or even maybe as early as today, the full data to the FDA, all their studies. And maybe you can get an emergency authorization through the FDA relatively quick for the Paxlovid. Omicron, I don't think that we've had the definitive answers on it. It does seem to be as least or more transmissible. Doesn't seem to be as severe. I think before last I read that in South Africa where it originated, they're not seeing a severity issue. The efficacy, there's going to be some efficacy still there, maybe slightly not. I don't have the full, exactly where they're, the full information comfortable enough to say exactly what's going on. It's just early indicators that it may be more transmissive. And if it's weaker and more transmissive, that actually necessarily is a bad thing. Its severity is extremely important, and how severe it is, and the efficacy of the vaccine as well. So I don't have the definitive data on that. I didn't see anything searching. I haven't heard anything from the state on anything definitive on it. Face coverings, again, we're still at a mask advisory. I present this data to the Board of Health every week. Monday is our next meeting. And we'll talk about, where we are with COVID, and where the board may want to go. Nothing's changed with this, with the face coverings. Looking at our metrics, our positivity was pretty flat. We're in the high category, we're in the low category for positivity, high category for incidence. Our daily rate was 28.4 for the 21st to the 4th. State gives us that data in a 2-week chunk, the 2 previous full weeks to when they rate this report on Thursday. So it was a little bit delayed. And so that time frame from 11/21 to 12/4, Falmouth averaged about 9 cases per day, which is a weekly added incidence rate of adding 28.4 times 7, 198.8. Hospitalizations, we're in that sort of mid-range of where we are with hospitals. It's more than we'd like to see, obviously, but we're not necessarily seeing the ICU. Definitely better compared to Cape Cod Hospital, which was 26 and 3, bigger hospital. 8 and 1. It's not zero. I'd like to see it zero, but it's also not. I think our highest was in the upper teens for Falmouth Hospital. Our vaccinations again is strong with the adjustment into the boosters. I'd like to see obviously that the state produce a booster number for the towns. As a recap, case counts are definitely rising everywhere. It's high everywhere, locally anyway, at least in the state. Falmouth, we're holding our own against our peers. We didn't quite see an increase like we're seeing in other towns, but still nonetheless, it's definitely much higher. It's definitely increasing. Vaccine, again, eligibility, anybody over 5, third dose boosters changed to 16. You definitely want to consider them if it's been 6 months. We're awaiting more information on Omicron, and one other thing on the recap is if I can post a clinic or two in short order, we'll have additional booster dose clinics. However, that should not stop you from going on and getting an appointment at one of the pharmacies. Like I said, you've got 6 or 7 avenues locally. It just might take a few weeks or a couple weeks just because there's been a push towards getting boosters as the case counts have risen, and they opened it up to a lot of people by lowering the age from basically 60 a few weeks back, maybe a month back, down to 16. So you may have to just be patient on the booster. But that's what I have for I update this week, and again, we'll do this again on Friday. Thank you.